Why are young Indians are having sudden heart attack these days?
As such, there are multiple reasons for that. There's a genetic predisposition because diabetes, India is the capital of diabetes. So when diabetes is more common, definitely metabolic disorders and cardiovascular diseases are going to be more common. And lifestyle factors are also contributing to that.
So diabetes increases the risk of heart disease.
Definitely.
Hmm.
Because why we have to control blood sugar now so that patient will not have a problem after 10 to 15 years. You will not develop a cardiovascular disease or you will not develop a kidney disease, you will not develop stroke. So for that only we are controlling blood sugar now. And lifestyle factors like more and more of people, younger people going for smoking. And then
Smoking increases the risk.
definitely smoking increases the risk. And it is one of the easily reversible risk factor also.
Why do you say easily reversible? It's very difficult to quit.
No, so if they quit, then immediately their risk comes down.
Is that right?
Yeah, and by 1 year maximum reduction happens. But the sad part is that to reverse to a non-smoking level, it takes 10 to 15 years. But the cardiovascular disease to come to a non-smoking level, it takes 10 to 15 years. Even after 5 years after quitting, also some people may develop that. But definitely every year risk comes down.
For a layman, I'm just going to summarize what you said. Smoking increases the risk of heart attack.
Yes.
But when you quit smoking, the risk reduced by 10% every year. And in 15 years, it will come to the same risk as a non-smoker.
Definitely.
In your practice, smoking is very common these days?
Yes. Not only young men, even we see young women who have adopted smoking. Then they have taken that as a modern lifestyle
Habit.
habit. And women, yeah.
There was
we
not the
see
case 20 years ago.
No, that was not the case 20 years ago. Earlier, we used to, as doctors, we used to hesitate to ask that question, to take that history while we are examining and consulting a patient. But now we commonly ask for everybody, irrespective of whether it is a male or female, about the smoking history. And many men and a few women also, they openly accept also. They have that smoking respect.
And, I still remember vividly the case scenario. I had a patient. She was around like 42-year-old. And I'm a medical student. I was asking, okay, do you drink alcohol? She said, no. Do you smoke? She's like, how dare you can ask a question to me?
Yeah. So earlier it was like that. But now people are getting modernized. It's all urban society.
Does e-cigarettes has the same risk? Or is that a little bit less?
So e-cigarettes definitely has a risk. Maybe it may be little less, but definitely it has a risk that people wrongly assume that going for e-cigarette will not have any cardiovascular risk. No, e-cigarettes also pose a definite cardiovascular threat. So it's a misconception that e-cigarettes may reduce cardiovascular disease.
A person listening to this podcast, let's say their friend or family member is smoking. What will you tell them?
I would say that unlike other risk factors, like for example, diabetes or high blood pressure or a high cholesterol level, which is going to affect the individual who is going to have the risk factor. Smoking is a risk factor which is going to affect not only the individual who's smoking, but also the person who's nearby to him. So even the smoking person may have a filtered cigarette, he will have a slightly lesser inhale of smoking. That chemicals may be going inside, the inhale will be less. But the person who's next to him, mostly it is friends or relatives, family members who are going to be next to him, they're going to inhale that environmental smoke. That is called second-hand smoking or passive smoking. They are definitely going to have almost a similar risk of what the person who's smoking. Starting from it may be a lung disease, or it may be a cancer problem, or it may be a cardiovascular disease.
So passive smoking also increases the risk of heart disease?
Definitely. Passive smoking increases heart disease. Even one exposure of passive smoking, if the person is vulnerable and is going to have a vulnerable block in the heart, he may develop a heart attack also.
That's why they have at least smoking zones in the airport.
Yeah. Everywhere smoking zones, and whenever it is said that even the door of the smoking zone is open and somebody is passing by, they may still develop that risk of developing cardiovascular disease and other problems.
But most of the times it is open.
Yeah, it is open. That's why. So, and government has banned, not only in many parts of the world and India also, government has banned public smoking. People may not be aware why. To reduce or avoid cardiovascular disease only, government has banned the public smoking, and people have to obey that order. And still, many people don't follow that order in India.